Ethos Aesthetics and Wellness, and today we have a little bit of a treat. I'm going to be doing both neuromodulator injectors. In this case, I'm going to be doing Dysport, and I'm also going to be doing a little bit of cheek fillers and a little bit of chin fillers to soften out what we call the Marionette line or the Mental fold. And again, this young lady just wants a very conservative approach. Sometimes, to do a full facial treatment, we may use as many as 6, 7, 8 syringes. And while that may seem like a lot, when you know how to place them, the results can be very beautiful, soft, and natural. And I think the most important thing that I strive for when people kind of leave from Ethos is that they walk out looking like they were born with the features. So we want to really create a beautiful, balanced look without really exaggerating any of the features. The entire face, along with the individual components, should be in harmony. And my philosophy is that you can always add more if you really want to kind of improve on any of the results. But it's best to start small and just gradually build up the area. So we're going to start with Dysport, and as you can see, can you make an angry face? You can see that these lines in the glabellar region are pretty deep. We'll be able to soften them out. But once we've gotten to the point where they've etched in like this, while the Dysport or Botox or any of the other neuromodulators can help, they may not be able to completely relax it to the point where the lines completely go away. They may still be visible after relaxation. And one of the few things that can help do this is by putting fillers in here, in these deep depressions, and then you can get a really fantastic results. But I personally don't inject this area. To me, this represents a higher risk area because the vessels in this area do communicate with the vessels that provide blood to the eyes. So if you accidentally get some fillers in this area, there is a small and a rare complication, but it's real, that it can cause visual problems or even stroke and blindness. So as a rule, I've been injecting for 20 years. I don't inject this area. There are plenty of amazing injectors who feel comfortable injecting this area, and they understand the anatomy of this area. I don't have a problem with them, but from my perspective, it's not something that I care to do. I'm going to be quite pleased if I can soften these lines out. And in the future, some of these newer kind of things that are available, like PDRF and other growth factors, and maybe even some of the salmon PDRN, potentially can be injected in this area with maybe lower risk, and they can stimulate collagen. But for now, we're going to focus on relaxing the muscles. I think at the very minimum, it's going to help. It's going to brighten up the eyes a little bit, and we'll take it from there. So again, whether it's Botox, whether it's Dysport, this is one of the most popular treatments for a reason. That reason is that the results are consistent. In general, there are very few side effects. And even if you get some unwanted effects like a droopy eyelid, unevenness, asymmetry, some of those are amenable for correction. And even if not, remember, these results are temporary, and they will go away basically in anywhere from about 8 weeks to up to 4 months. So typically in the glabella you have the strongest muscles, and they typically require more units than elsewhere. And the function of injecting in this area, it's going to soften out these depressions, not completely get rid of them, and it's going to give her a little bit of an eyebrow lift, which almost everyone likes. The next area we're going to inject is the forehead. Lift up your brow. Overall, not too bad. You can see some of the lines. They're starting to etch in a little bit, but they're certainly not as deep as the lines in there. So we should be able to get most of these lines relaxed and completely gone. I like to keep my injection points fairly high up in the forehead. The lower down you come on the forehead, the greater the chance you risk that someone may experience a little bit of the brow heaviness, which certainly we don't want. And your forehead muscle, also known as the frontalis, is really the only muscle in the upper face that's called an elevator. It's the only muscle that typically lifts. So if you relax a muscle where the primary job of that muscle is to lift, then you're potentially risking kind of that heaviness or that droop. So most patients, including women, I tend to be a little bit more conservative, and I tend to keep the points up a little bit higher. Last area we're doing are the crow's feet. Smile for us, please. So she's got a few lines, and maybe because she's not giving us a full smile. There we go. But again, these are superficial. In general, these are very amenable to treatment. My first injection point is close to kind of the tail of the brow. And again, injecting here does create a little bit of a lift. Around the eyes is a little bit sensitive. So again, she's jumping a little bit, but that's okay. And this area is done. We're going to finish up the other side, and fortunately for us, we can see the blood vessels. We want to try to avoid them. These are also superficial injections, tiny pinch. We don't need to go very deep because number one, it's not necessary. Tiny pinch. Number two, it can hurt a lot more. And number three, we can risk bruising if we go too deep. And again, superficial, we want to create these tiny little blebs. And we are done with the first part, which is the distal in this case. For our next part, we're going to be doing just a little bit of cheek fillers here and here. Normally I would use one syringe, but again, she wanted a little bit more of a conservative look. So I'm going to just start with half a syringe. Like I said, we can always put a little bit more. My favorite go-to technique is using micro cannulas. So even when I'm filling this malar or lateral cheek region, I only need one point of entry. And a lot of times, just from this one point of entry, little pinch, little pressure, and tiny pinch. And we're in. So it's just a quick little pinch. It's going to be a little bit of pressure. My cannula is underneath the skin. And again, when you're deep enough and you're putting the product in, you're not going to see a lot of rise in the tissue. The more superficial you are, the more the tissue is going to come up. But again, in this area, we do have to be a little bit careful because there are structures in this area, such as your lymphatics and your superficial fat pads, where if you inject in them, sometimes you can make the puffiness look a little bit worse. And there we had a syringe malfunction, which can occur. Sometimes from the pressure. It's okay. Just going to get another syringe because that was unanticipated. Guys, I'm back. It's been a while since that's happened, and sometimes it's because I didn't screw it on tightly beforehand. Remember, you're pushing out this product through a tiny tube which has a little hole in it. It's a lot easier to push this out through a syringe which is shorter because I don't need as much pressure. I am going to go back in and finish up with a little bit more, but again, I can use the same point of entry. I'm lifting up, getting down to bone, and then just a little pinch, and we're in. A little bit of pressure, and I may have been pressing a little too hard, so let's just go a little bit slower. And again, I got most of what I wanted to do here, so I'm not going to be doing all of this. And then I can even come underneath the eye a little bit and just support the trough. And I think that's it. So again, you can see there's minimal bleeding, there's minimal discomfort. We don't have to coat multiple areas. And you can just see a soft, subtle, beautiful transition from the mid-face to the lateral cheek. Now we're going to do this side. Again, I had previously provided some anesthetic. Same thing, we're going to go in here. I'm going to go down and I want to feel that bone, because again, this is meant to be placed deep in this area. Tiny pinch. Great job. We're in. A little bit of pressure. And again, we're going to take our time and slowly build that cheek region. As I mentioned, it's very important to be in the right plane and the right depth. And part of the reason is, if you're too superficial, you can really create a little bit too much volume. You can create puffiness. You can affect your lymphatic chain over here, which can cause puffiness and swelling. And sometimes that can take months to go away. And sometimes, if you've disrupted enough of the chain, it may certainly last a lot longer. And again, as you can see, I'm doing depots, doing a little bit of threads. And we're almost done in this area. Kristen here is doing fabulous. Doesn't seem to be too bothered by it.
Not at all.
You know. And that's it. So this area is done. And again, we only had kind of that one point of entry. We minimized the trauma to the area, and that part's done. So the size of the cannulas that I'm using are 25 gauge, 1.5 inch. Cannulas come in many different sizes. You can have larger ones, you can have smaller ones. In general, the larger or the thicker a cannula, the safer it tends to be. And I'm just going to start on that side. Now, why I use the cannulas is because, in my opinion, they're a little bit safer. The tip of the cannula is blunt, so it has a lower risk of entering a blood vessel, causing kind of a blockage in the blood vessel, which can certainly have dire consequences. Now, this doesn't mean the risk is zero. You can still enter a vessel with the cannula, so you still have to be diligent and kind of watch the area you're injecting. And so now, just she has this marionette line that's forming, so I want to be just underneath the skin. Sorry, my dear. Great job. We're in. Around the mouth it's a little sensitive, so it's understandable. And again, we're just going to do a small threads. And you want to keep that cannula moving. And we're just going to support the chin a little bit more. And I'm going to put a little bit in the crease right here. You're doing fabulous. And that's it. This side is done. We're going to finally finish up the left side. Again, you can see a little bit of the blanching there. Did you jump because you felt the pinch?
Mm-hmm.
You did?
That's all.
So much for the numbing.
It's okay.
It should have been a tiny pinch.
It was.
It wasn't. It wasn't too bad.
Mm-mm.
Well, where you see the blanching, it is supposed to be numb. And what I'm looking for is that tiny drop of blood because that's my entry point. And I want to get in there. And again, I want to be in front of that fold because if I put any product in here, it can potentially make the jowling worse. So tiny pinch, my dear. Here we go. Great job. And you can see the cannula. So it's deep enough that it's underneath the skin, but it's not so deep that you can't see it. Because if you go any deeper, then you can potentially end up putting product into the oral cavity. So again, we're going to kind of come up into the area and just tiny threads. And I'm keeping that cannula moving. I'm going to go into kind of this crease right here. And you can see the tip of the cannula. Again, small amount. And from this point, you can even kind of enhance the jawline, and I'll show you what that looks like. So, little pinch here. And we can just put a thin thread there. That's it. We are done. So, the benefits of this procedure is that there's very low bruising. As a matter of fact, I got more bleeding from the botulinum toxin injections, from the Dysport injections, than I actually got from the filler injections. And overall, she was very comfortable. There was very low pain. Few areas where, you know, she may have jumped a little bit just from the pinching, and we had that syringe malfunction where I didn't have the cannula on tight enough, and kind of just as I was finishing up, you saw it explode. It's been a while since that's happened, so a little bit embarrassing, but we got through it. And under ideal circumstances, you know, we would have her come back. I may consider doing a little bit in the lips, maybe a little bit in the tear trough, a little bit in the jawline to really kind of give a little more definition. But again, she wanted a little bit more conservative results for the first time. And that's the beauty of fillers. That's the beauty of coming to Ethos. You know, we're willing to work with everyone and within your comfort levels. For the most part, we really want to create results that are very natural and authentic. And when you walk out of here, there's typically very little bleeding. You can oftentimes go back to work or carry on without any kind of interruptions. However, sometimes even I get bruising. Usually it's minimal, although a few times I've had pretty significant bruising. But fortunately, we have a laser here as well, that if I do accidentally bruise you, or one of us does, we can zap that area, and within 24 to 48 hours, that bruise is already starting to clear up. So hopefully you found this informative. She was amazing, so thank you. And we're going to be posting the results very shortly of not only the fillers, but the Dysport. The Dysport, as you know, will take up to 2 weeks to kick in. So thank you for joining us today.